So I'm just going to welcome you again to our UC San Diego Health Insurance Requirement webinar. During this webinar, you may type questions in the Q&A box. Keep in mind, I may answer your question in this presentation. So any duplicate questions will be answered live at the end of the slideshow. And this webinar is scheduled for 1 hour. Any questions that are unanswered, feel free to send us a message via email or call our insurance line, especially if you have any confidential care questions. Once you email us, we'll be able to work with you and answer your specific questions. Today, we will share some insight on the student health clinic on campus. What is the health insurance requirement and the mandatory health fee? The UC student health insurance plan for students who already have coverage. What if you already have insurance? One of the offerings that we provide for students who do not have UC SHIP, which is called RAFT, and some other online resources. There's a QR code provided that will take you to the student health insurance office info sessions. It's going to be very similar to the one today. So please attend one of these Zoom offerings just for all the helpful information that you'll need to succeed in your college career. All right, so this is a picture of the Student Health Clinic. We're located on Library Walk across Price Center, where Target is, and the bookstore. For UC SHIP participants, the Student Health Clinic on campus is your primary care home. This is where you should start your care if you're not feeling well or if you need any preventative services. It's the most cost-effective option for vaccines, labs, and pharmacy services as well. Students from other UCs can visit our clinic, and our students may visit any of the other UC student health clinics throughout California and receive the same benefits, with the exception of Berkeley. Availability to see the student health primary care providers, it's pretty good, and this clinic is not open to the public or to staff members. It's only for UC students. Dependents on SHIP may visit primary care physicians and specialists in the community. And we're partnered with CAPS, which is the Counseling and Psychological Services on campus for mental health, and we work very closely with them through a referral process. As a reminder, all UC students are welcome to the Student Health Clinic on campus. We don't hold contracts with other insurance companies other than UC SHIP carriers, so we cannot bill your own insurance. What we would do is have you pay out of pocket for fee-for-services. We can provide you with an itemized statement where you would provide that to your insurance, hopefully for reimbursement. Upon request, yes, we will be providing you with the detailed receipts that you can use, again, with your insurance company. The cost for physician evaluation can range from $89 to $150, depending on the services provided. The Student Health Clinic is open year-round and during school breaks. Please log on to your My Student chart to schedule an appointment or contact the main line, 858-534-3300, to speak to a registered nurse. This is actually our aftercare advice line. And so if you call after hours, you'll speak to a clinician who will be able to provide you with the clinical advice. For your protection, as well as the university campus, it's required that all UC students have comprehensive United States-based health insurance that covers you for primary care, outpatient services, inpatient hospitalization, and mental health. In order to make sure all students are covered by the university, they automatically enroll each student with a health insurance. It's part of the non-academic requirements of registration. But don't panic, we'll go over how to opt out as well. So if you take a look at the cost of the academic year, for the upcoming academic year, For undergraduates, the health fee premium is $753 per quarter. For graduate students, it's $1,470 per quarter. That is fall, winter, and spring. When a student is enrolled for spring coverage, they have coverage through the entire summer. That way there is no gap in coverage if they enroll for the upcoming fall. It does sound like a lot of money, but if you break this down on an annual basis, the $753 for undergraduates times 3 is $2,259. But broken down on a monthly basis, that's $188.25 a month. For grad students, $1,470 times 3, that's $4,410, which sounds like a lot, but broken down on a monthly basis, that's $367.50 for a comprehensive insurance plan. And we'll go ahead and go over the SHIP benefits next, actually. So while the university has specific health insurance requirements, they do provide Tritons and the other UC students with a comprehensive plan called UC SHIP. UC SHIP offers coverage for medical, mental, and pharmacy unlimited. Anthem Blue Cross manages the medical care, and they provide 3 tiers of benefit. 3 tiers of coverage for your benefits. The first tier is if the student uses a UC family provider, where they would be responsible for a $10 copay and 10% co-insurance. The second tier of benefits is with an Anthem participating provider. This allows the student to be seen by a specialist for $30. There's a $500 deductible, and once that's met, there's 20% co-insurance for the remainder of the academic year. And the third tier provides worldwide coverage at a 60% reimbursement rate, which qualifies for EAP and study abroad programs. The student health clinic on campus serves as the primary care home for these students covered by SHIP, but all registered students can utilize student health as a campus resource. The QR code here will take you to the UC SHIP benefit booklet for detailed plan benefit information. So students who already have a health plan, you'll want to consider a waiver. If students want to avoid paying the registration fee for UC SHIP, they'll need to be registered for fall quarter, and they'll want to file a health fee waiver timely for consideration. All students must have comprehensive insurance that meets the UC Office of the President waiver criteria in order to be approved. The QR code will take you directly to the UC insurance requirements that the brokerage company Academic Health Plans will review. When each student submits a waiver application, they will receive an email from Academic Health Plans stating that their waiver application was received, and to keep that email as documentation in case you may need it later. Please remember that all students must renew their health fee waiver each school year, and we do not accept late waivers or requests for retroactive waiver applications. Lastly, if you're considered an international student with the university, you'll need to follow all of the requirements, including the medical repatriation and the evacuation requirement. So for students who are under an HMO, Kaiser, and Medi-cal plan, you'll want to listen closely. While most health plans meet the health fee waiver requirement issued by UCOP, the criteria can be found on our website if you have questions. And one of the major requirements is that students must access and be assigned to a primary care physician within 40 miles of campus. While this isn't an issue for PPO, EPO, or POS coverage, it's really challenging for those students who belong to an HMO or Medi-cal plan. So keep in mind, Medi-cal assignments must be assigned within San Diego County to receive a waiver approval. This is challenging for those students who belong to an out-of-county Medi-cal plan or an out-of-county San Diego HMO plan. Medi-cal assignments must be in San Diego. And again, we will not accept coverage in any other county for the health fee waiver. So now is your time to contact your Medi-cal office and let them know you need to be reassigned to San Diego County. The waiver has been open since May, and so it does provide enough time for students to transfer their care if that's what they are interested in doing. But you need to hurry up as time is running out, as it can take up to 45 days for your Medi-cal transition to complete. You may also want to transfer them back to your area if you want to have access to your primary care home while you're on breaks. But I'm going to be honest with you, many students let us know that transferring your Medi-cal county is not an easy process. So you might want to consider UC SHIP. And I also included the financial aid and scholarship office here, because the university is a little separated. This office can let you know how to use SHIP or how to waive out of it, but we do not see how SHIP fees are paid. So if you have an out-of-county Medi-cal plan, it's recommended you contact financial aid to see if you are eligible for one of the grants. That'll save you a lot of headache from transferring your insurance plan. So keep in mind, if you do submit a waiver application and you provide any of these kinds of insurance cards, like the state of California card or an LA Care Medi-cal card, this is your warning that your waiver application will get denied. You'll need to have a San Diego Medi-cal plan, such as Kaiser or United Healthcare or Sharp. But if you provide something that's way over 40 miles of campus, then you'll get denied. Thank you. So if you plan on waiving UC SHIP, you'll be required to upload your insurance card, a copy of the front and back. It's also recommended that you upload a summary of coverage. This is a universal informative document generally found on your health plan website. Although the summary of coverage is not required, by adding that to your application, it will definitely expedite your application. And then also, if you plan on keeping UC SHIP, you'll want to log on to the myucship.org page to learn how to access your electronic insurance card, which looks just like this, and also the summary of benefits and coverage. So the very last question of the waiver application will ask if you'd like to opt in for RAFT, and RAFT stands for a reduced access fee for Tritons. For those students that have decided to waive the health insurance through the school and are new to the San Diego area, we strongly suggest you think about picking up the RAFT option. RAFT is a prepaid membership to the student health clinic. The student will receive, hi again. The student will receive scheduled provider evaluations. They can get lab services and x-rays at no additional charge other than the $70 quarterly fee. Again, it's the last question on the health fee waiver. And RAFT is not an insurance, but it provides a little peace of mind for students or family members. RAFT does allow students that are not feeling well to go to the student health clinic to be seen without leaving campus. And all the students would do is make an appointment to see one of the providers. If it's recommended for the student to continue care with a specialist or pick up a prescription or have a diagnostic service, they will be advised to contact their home insurance carrier to get further direction. UCSD has a pharmacy, but the student will need to pay full price for the prescription and then seek reimbursement from their insurance company. There's also a Target here on campus with a CVS pharmacy. There's also a Ralph's pharmacy and a Rite Aid pharmacy within walking distance or a short shuttle ride away, where students can use their home insurance to receive their prescription and have it billed directly to their health plan. And keep this in mind. Students who waive can still use the student health clinic. All UC students are welcome to this clinic on campus. All students are welcome to use the other clinics throughout California as well under the same benefits. But if you are on a fee-for-service basis, you still can access care here. We'll provide you with an itemized statement that you can provide to your insurance company. And so regardless of what insurance you decide to keep, whether it's SHIP or your private health plan, it is each student's responsibility to know how to navigate where to go for care. Their responsibility to know how to file a claim if they come to the student health clinic, but just know that the student health insurance office is here to support you. And our next slide does provide information on how you can get a hold of us, whether it's through phone or email. We're currently not seeing students in person, but we do have Zoom sessions where you can log on and ask us your question, and we'll be able to assist you that way as well. But for more information on the mandatory insurance requirement, feel free to use this QR code. It'll just take you directly to the student health insurance website. And yes, if you have any questions, now's the best time. It looks like Jill has managed the Q&A box, but we'll go ahead and be helpful in any way we can. That concludes our presentation. Thanks for listening.
Lots of questions in the Q&A.
Wow.
Keep me busy. So hopefully I answered you and you understand what I'm saying. And otherwise, May's going to take a look, and we have some Q&As that we'd like to answer live. My name is Jill Batika, and I'm the Insurance and Billing Manager at Student Health here on campus. At the University of California, it is a requirement to have health insurance. And as May said, it's to protect you as well as our campus. We have a lot of activities going on with 43,000 students. 54% of the enrollment to the school, undergraduate as well as graduate, enroll in the SHIP program. We have 46% that waive out, and the #1 insurance that they use to waive out with is Kaiser. If you have a Kaiser plan that's an HMO benefit through an employer group, or you purchased it through the exchange for private, then you just have to have a Southern California medical record number in order to meet the waiver requirements. And you would do that by contacting the member services line at Kaiser. That will get your application approved pretty quickly. For those students that are incoming undergraduate, yes, as of yesterday, they pushed back your registration date, but the waiver deadline is September 20th. We extend that to September 25th with no late fee attached to that, but anything that we receive after September 25th will not be recognized for the fall quarter. We do open up the waiver prior to winter and spring, about a month before the quarter starts. So if you do miss fall, you will have to pay for the SHIP for fall, and then you can file a waiver prior to winter, which will approve you for winter and spring. And if you miss winter, then you can file it before spring. But you do have to renew that waiver every school year because we have so many students, we can't verify that you have the same coverage each year. And there are life events that happen. People lose jobs, get jobs, and they have different insurance that might be covering them. So you do have to renew that waiver each school year. For the international students that might be arriving prior to the start of the school year, the first day of coverage this year is September 25th. That's our first official day of fall, but instruction doesn't start until the 28th. So just make sure that you have coverage in place by the 25th if you are planning to waive. Otherwise, your insurance through SHIP will start on the 25th. And that'll be the first day that you can download that app, Sydney, to get your insurance card. So those were some of the repetitive questions, and I hope that I answered those clearly. And May will start asking me some more questions. So
Yeah, absolutely. There was a question about how do they know if they qualify for a grant? And so we just refer students and parents to the financial aid department. Another question was, what do you recommend international graduates who'll be entering the US a couple weeks before the quarter?
yeah, I'd look at a travel plan online to see if there's something that might meet that your requirements for that gap. Otherwise, I think you have your home insurance and that might cover you if something super bad happens. But check with your insurance company and see if they offer any gap insurance. Otherwise, there are 3 recognized travel plans that some of our students purchase, and that's through ISO and PSI and United Healthcare. It's student Medi-cover. So if you want to take a look at those plans, they might be available to you for a couple of weeks or a month at a month-to-month plan. And May did offer those in the chat.
Actually, I just sent it to you, Jill.
Okay.
I'm sending it to everybody now. There we are.
And really the #1 means of correspondence on this campus is your email. So please make sure that you're using your ucsd.edu email. And hopefully you'll be paying attention to that because important messages come through there. For those of you that are filing a health fee waiver, when you submit your application through the Triton link, you'll get an immediate email response saying that you have a tentative approval. The waiver company will respond to you within 7 to 10 business days on the final determination. So watch your email because they may ask you for additional documentation to verify that your insurance is valid and meets our criteria.
Hey, Jill, if a student doesn't have a personal copy of their insurance card, are they able to upload their parent insurance card instead?
Yes, that'll work. The company that manages our waiver is called AHP. It stands for Academic Health Plan. And they manage our enrollment and they manage our waiver process. They need that ID number to verify that you have coverage and the parent subscriber is fine. Also, if you are VA, if you have a Veterans Association benefit, I know they don't hand out insurance cards, but you can scan your military ID or your driver's license in order to upload that card.
Awesome. How can I get a recorded session of this?
So later on today, like May mentioned, we'll be putting the posting of this video up on our website, and that's studenthealth.ucsd.edu. You want to go to the insurance tab and it'll show webinars, it'll show our schedule, and it'll show the recordings.
Awesome. Will the other webinars be similar to this?
Yeah, they're for incoming students. We will be doing more outreach during the school year about what the RAFT offering is and billing.
What is Early Start UC SHIP? Can only students who wish to enroll in Early Start submit?
So early start coverage, you would know if you're part of an early start program. Those are students, undergraduate. There are only 3 departments that do this and are athletes. And then many graduate departments where you have to come on campus to attend orientations or training or classes earlier than the rest of the academic year. You're given a form by your advisor of the department and asked if you would like to elect early start SHIP. You are the only one that can do that. That's not open to the public. Other students can't participate. You have to be in that particular program. So if you do have questions about that, see your department advisor or contact them and they'll be able to let you know if that's offered to you.
Thanks, Jill. How does coverage work off campus? What is considered in-network or out of network?
Great question. So under the UC SHIP plan, it's an Anthem Blue Cross PPO plan, but referrals are required for everything outside of the student health clinic, except for urgent care, emergency room, dental, and vision. So to find providers, you would go to anthem.com once you receive a referral from one of the primary care physicians here at Student Health. If you're outside of the area on break or you've taken a trip or you're working remotely, then you would want to contact our clinic The doctor here will write you a referral to see a primary care physician in your community. And then you would contact Anthem either by their website or calling them and let them know the zip code that you're in, and Anthem will recognize any of their contracts nationally. They contract with Blue Cross and Blue Shield, so they have a wide network nationally. And also this coverage is global. So if you are going on an EAP trip, or you're doing a travel or global seminars, or you're taking a trip with your family, or going down to Mexico for spring break or something like that, you do have coverage globally, and it's 60% reimbursement after $1,000 deductible is met. You have to pay for the services outside of the country, and then you would file a reimbursement claim when you return to the US.
Thanks, Jill. How can students see a list of network providers?
So for students that are on Anthem Blue Cross through the UC SHIP program, you can contact them by telephone number 866-940-8306, or you can go to the Anthem website at anthem.com. It'll ask you what type of plan you have, and one of the drop-down options is student health. The plan that you are going to be part of as part of UC SHIP is devised only for the UC system. It's not sold to the public, and it's a very generous offering with minimal out-of-pocket experiences for co-pays, co-insurance, and deductibles.
Thanks. Someone asked about RAFT services. Here's the specific link so you can see what's included and what's not included. But hey, Jill, where do students go during Friday to Sunday when there are no office hours?
Good question. So no, we're not here. During the school year, we do open on Saturdays from 9 to 12 for urgent care and pharmacy needs. Other than that, we have a urgent care on Via La Jolla Drive, which is within walking distance of our campus, that is part of our UCSD health system. We're lucky enough to have 3 comprehensive acute hospitals near us that are all UCSD health system hospitals, where we have over 300 specialists and over 400 acute beds in each facility, which they have an emergency room that you could go to if it's an emergency. But if it's an urgent situation, go to the urgent care down on Via La Jolla Drive. It's a shuttle right away, or you can walk, and they'll be able to make an initial evaluation. If you are part of UC SHIP, it's a $25 copay to go to the urgent care. If you go to the emergency room, it's a $125 copay.
Thanks. Okay. We have some specific questions. If we're currently on San Diego Anthem Blue Cross health insurance through Covered California, do we need to do anything additional other than cancel that plan by September 25th when we start UC SHIP?
No, if you plan to have the SHIP, yeah, just make sure your termination is in place. They're usually month to month, so there might be a few days where you have double coverage. If you do have a commercial plan like Anthem Blue Cross, HMO, or PPO, not part of the UC SHIP, or Aetna or United Healthcare, just make sure that you contact them and let them know that you have you're moving to San Diego and that you need to have a primary care physician in the community, so that if you do wake up and you're sick, that you can contact them and make an appointment. The UC SHIP again will start on September 25th. So it might be a little bit of an overlap. If you have a commercial plan, that commercial plan will be primary over the SHIP for the time that you are double covered. If you have Medi-cal or Veterans Association benefits or Medicare, those would be secondary to the UC SHIP once you're outside of the student health. You always want to make sure that you contact your coordination of benefits under your membership number on your insurance, so that when they do receive those claims, you aren't getting denied on both sides and getting a bill. We can help you with that, but if you contact coordination of benefits, then they'll have all the information. And if you are planning to have double coverage or multiple coverage, please make sure that when you go outside of the student health clinic to access care, that you're presenting your insurances to the provider so that they can bill appropriately.
Thanks, Jill. I'm including in the chat just a link for our website for those who have an out-of-county Medi-cal plan, just like a tip sheet of what to do if you want to transfer your care. That means if you do not want UC SHIP. Because the other option is just keep UC ship.
Most of the time, if you do have Medi-cal, UC ship is going to pay for the primary bill. And then if there is a copay or coinsurance, that can usually bill to the Medi-cal provider, and they'll generally pick it up. I wanted to say, Georgie, I see that your hand's up. But if you could ask the question in the Q&A, then we can get to your answer. Otherwise, we won't be able to have you talk because you're disabled on the chat and the voice.
Oh, yes. So Georgie's question is UCSD medical school specialist in our network?
So those are two different things. UCSD School of Medicine is the school, and those are students that are attending to become a doctor. They don't provide care to students or patients at all unless they are on rotation, and that would be outside of the school. UCSD Specialty Network is part of UCSD Health System. That is separate from the school. They have their own health system, and we are the campus. The student health clinic doctors here do not contract with any insurance companies. They only participate in UC SHIP. So if you're trying to transfer your care from a commercial plan, let's say Aetna, if you wanted to pick a student health provider to be your new primary care, you can't do that because Aetna doesn't recognize our doctors as contracted entities. So the student health clinic doesn't contract with outside insurance companies. So you would have to find someone in the community in La Jolla, San Diego, or Claremont. Take a look at those areas, and then you'll be able to pick a primary care that's either within a shuttle ride, an Uber, or you could walk to them. We have many medical facilities around our campus.
Thanks, Jill. Okay, so.
Also, the doctors that we do have here are experienced, seasoned doctors that have, some of them have subspecialties like dermatology or gender affirming care, OBGYN. If you want to take a look at our website, again, studenthealth.ucsd.edu, you can look at their resumes and pick a doctor that's appropriate for you.
Thanks. Are you allowed to recommend? Oh, wait, I think these questions are gone. Is there a difference in cost or coverage between seeing a primary care physician at UCSD Health or at another in-network Anthem Blue Cross facility? Let's see. It's free if you go here.
If you're coming to student health and you have UC SHIP as the Anthem Blue Cross provider, you're not going to pay anything to have services at our student health clinic. If you're waiving the UC SHIP and you have an Anthem Blue Cross HMO or PPO, you probably have a copay under your plan. If you go to a UCSD family medicine or internal medicine health system provider, you'd want to contact your member services phone number just to verify that and who you can go see.
Can we cancel the SHIP waiver if they've already been approved?
Yeah.
There is a change in current, or there is a change in current health insurance. Okay.
So you can cancel the waiver up until the first day of the quarter. You would file a waiver cancellation form, and that's found on our website. Also, if you have a life event that happens, you get married, you have a child, your parent loses a job and they lose their insurance, that's called an exception to closed enrollment. And that form is on our website as well. And you would file that with a termination letter from your insurance, and we would load you into the UC SHIP enrollment when you provide that to us. There is no proration or discount in the premium though. So no matter what time you would add that, you're still paying the same premium of either $753 or $1470. And someone had asked prior why the graduate is so much higher than the undergraduate premium, and that's based on utilization. So undergraduates don't use the insurance as much as the graduates, and they don't want to subsidize the graduate premium. So that's why there's a big discrepancy between the two. Graduates usually have families, or they add dependents, or they have babies or surgeries, and they have time to go to the doctor, when undergraduates, they're not so focused on that. So that's why there is a big discrepancy with the two premiums.
I know that this is not the immunization webinar, but there is a question. If shown overdue vaccines on your My chart, but they weren't the mandatory ones, do we need to renew them or could we choose not to?
I am not an expert on this, but what I would suggest is that you contact Ask a Nurse through your My Student chart. You can send a message to one of the registered nurses here on campus, and they can explain to you if you need to get that updated or boosted.
Okay.
Also, if you do belong to UC SHIP, all immunizations are free if they're obtained at the Student Health Center.
Okay.
That includes COVID.
So at the end of the slide deck, I said that we're not seeing students in person. I actually just meant the student health insurance coordinators, but if you want to schedule an appointment at Student Health, it's absolutely in person. But if you're in California, you can schedule a virtual appointment with the student health provider. Hope that helps. Is there a way to check the formulary before starting?
Yeah, the formulary is on our website under the pharmacy, and that's managed by Optum RX.
For you, I'm going to put a website on it. There we go. So if a student decides to sign up for SHIP after the start of the year, let's say winter quarter, is this an option?
Yeah, you can go back and forth. Also, for those parents that are listening, if you weren't paying attention when May was talking about the RAFT, that's peace of mind for a student's family. If you're leaving your normal geographical area and you're coming to San Diego and you don't know how to find things on outside of the campus, the RAFT is $70 per quarter. It's a membership to come into the student health clinic and not pay for anything other than that $70 per quarter. So you have your own insurance. If you come to student health, let's say you wake up and you don't feel very good, you want to see somebody just to have an initial evaluation, you could walk right into the student health clinic, be seen. The recommendation may be made by the doctor that you either pick up medicine at the pharmacy, or you get a prescription, or you go to the next level of care, which to see a specialist. We're going to refer you back to your home insurance so that that would be covered by your plan. So if you go see someone as a specialist or pick up a prescription, that it's covered by your insurance company. So one evaluation here without RAFT would be $89 to $159. If you have x-rays or additional labs or anything like that, that's going to keep going up per service. But if you're okay with that, then you can come here. Everybody's welcome to come here. It's all based on your payer classification. And then you're either UC SHIP, RAFT, or you are fee for service. And like May said, we'll give you detailed coded receipts that you can work with your insurance to seek reimbursement. Just a caveat to that, again, we don't contract with insurance companies, so the student health clinic is viewed as out of network under every insurance company.
Okay, so a student just said, assuming we get a fracture and surgery, do we then also visit the clinic?
Yeah, it all depends on your particular situation. If you are going to an emergency room because you've fallen down and you have hurt yourself and you need surgery, the hospital is going to communicate that to us. And your primary care physician is going to write you the referrals that are necessary to continue at the specialty level. So you may not come see us, but we will be driving your care so that we are making sure that you're using the most cost-effective providers and you're going to the correct providers for care.
All right, on a personal level, since keep in mind, we work for the university, we sponsor this insurance plan. But if I was a student, I really would take this insurance plan. But so Jill, what is your take on UC SHIP versus other plans for international graduate students? The latter seems to be a lot less expensive. What should one be wary of while researching options?
Your out-of-pocket expenses. So if you are looking around for plans, just make sure that you don't have a super high deductible, because a deductible is what you pay first before the insurance starts paying. So if you have high deductible, or if you have to pay a lot before you can access care, that's not a good plan for you. But it might be if you never go to a doctor. It's for those that might have a chronic illness, you want to make sure that your copays are affordable, and that you are accessing a plan that has options available to you for specialty care, good prescription coverage. It may be less per month because we are pretty generous with this plan, and that's why it costs so much money. If there is a plan that meets your needs on the outside, definitely take it and then file a waiver. If you feel like a RAFT is necessary, then pick up a RAFT. That $70 will pay for itself in one visit. If I am a parent, which I am, and I have a 25-year-old that went to college outside of California, I have insurance that will pay for him for hospitalization, mental health, all of that, but it only pays for him when he's in this area. So I would pick up a RAFT if they offered it at his school, just to make sure that I know that he can go see a doctor when he needs to and get the referrals that he needs in order to continue his care. So just my 2 cents, but make sure that you're not paying so much out of pocket and that you have a good network to go to, and it's nearby or near your residence.
So a parent or a student is saying, if we are from Los Angeles with Medi-cal, should we try to transfer this to UCSD or just keep SHIP? I said it's a personal preference, but if they do transfer their Medi-cal care, it's going to be a headache for the student when they go back to LA.
Yeah, I concur. But if your student is getting financial aid, please keep in mind that that insurance payment for the health fee that they're receiving as part of their financial aid, if they don't use it for the UC SHIP, it will be taken back. They don't get that as an extra allowance. So you will receive the funding from financial aid, so you might as well take the SHIP and use your Medi-cal as secondary and not change the county. And that way, if they go home for breaks, then you can use your Medi-cal product.
Awesome. So it looks like we have some grad students who may become a TA or GSR, and they're hearing that insurance is covered. Would that be the same thing as UC SHIP, and are all the same things covered?
Yep. So if you're under a UAW contract, you're part of their union, you've been employed as a reader or a TA, you will be getting the UC SHIP. What your department does is it gives you funding to pay for that as part of your tuition fees, and you will get the UC SHIP coverage. So it is offered to dependents, but they won't pay for that. You have to pay for that out of pocket. So if you have a spouse or a child that you need to have covered, you would go through our website and fill out the application to add a dependent, and then you have to pay AHP to enroll that dependent quarter to quarter.
Okay.
It's kind of expensive. It's about the same as what you have as a student, if you're a graduate student. So you can certainly go to Covered California and see what your options are. Just a suggestion.
Yeah. Does UC SHIP also pay for prescriptions? Can you share an example with the amounts? I'm including the summary of coverage. But Jill will still go over it.
So if you do get a prescription and you pick it up here at Student Health, there's an incentive because you're going to save about $5. So if you pick up your prescription here at our pharmacy under SHIP, it's a $5 copay for generic drugs. If you pick up a brand name drug here at Student Health under UC SHIP, it's a $40 copay. If we write you the prescription and you go over to Target or Rite Aid or CVS, you will be paying $10 for a generic drug and $100 for a brand name drug each time you pick up your prescription. So definitely pick it up here if you can. And we'll also work with you. Our pharmacist is really good about transferring prescriptions where they need to be. If you go home on break and you need to pick up a prescription, we can send that over to a participating pharmacy so that you can pick it up out there, but it may cost you a little more out of pocket. And I think May mentioned this, but within about 500 yards of our front door where you check in, we do have a Target, and they have a CVS inside of that Target. And also we are within walking distance to Rite Aid, Ralph's Pharmacy, and CVS.
So in case of an emergency, would you recommend students going to an emergency room off campus, or would you recommend going to the student health clinic on campus?
Yeah, that's outside of our scope. So you want to go to the emergency room outside of the campus. So if it's a catastrophic situation, you get in a car accident, you need immediate care, you need to go to the nearest emergency room. If you're ending up at UCSD Health, even better, because if you were hospitalized, it's going to cost you less out of pocket. But it's $125 copay flat for any emergency room care that you have nationally.
Would you recommend having both UC SHIP and an additional health insurance, or is the UC SHIP insurance enough, especially for international students?
The UC SHIP is enough, but again, this is a personal preference. So if you go to the doctor a lot and you have a lot of out-of-pocket expenses, you may want to coordinate with another commercial plan just to make sure that they're picking up as much of the bills as they can, because healthcare is expensive. But this Anthem Blue Cross plan is more than you can purchase through an exchange or privately. Employer groups do not offer what we are offering here. We have many benefits that employer groups do not offer to their employees. So please take a look at our benefit booklet. If there's something specific that you want to find out, definitely look at that benefit booklet and make sure that this plan meets your needs.
It's Joe. So keep in mind, we do not see how fees are paid. If you're a grad student and your department says that it's being paid for, I would verify with them, but it sounds like that it is going to get covered by them. Okay.
Yeah, I know a lot of people asked about if their financial aid or their Cal Grant covered the insurance. Our general answer is yes, it does, but we would definitely want you to verify that with financial aid. They're there to assist you and tell you of your individual award. And May has provided their phone number and their information. It's 858-534-4480, and they do video visits. So you could certainly tap into that and just make sure that you're not getting a surprise bill.
Oh, yeah. Oh, hey, Jill, does RAFT include mental health services?
Woo-hoo. No, it includes it as a campus fee. So we have counseling and psychological services. We have about 50 different offerings on our campus for psychologists and counselors. And that's part of your fees that you pay to the school, regardless of if you keep the SHIP or if you have a RAFT. So you're paying about $30 per quarter to be able to access CAPS on campus. They can write you a referral to go externally to see a psychologist or a psychiatrist, but that would be covered under your insurance. If it's UC SHIP and you utilize a UCSD health provider, it's a $5 copay each time you see a psychologist. If you go to an Anthem Blue Cross network provider outside of the UC system, that's a $10 copay each time you go to a mental health provider. If it's under your plan, you'd want to contact your member services to find out if there's a referral requirement or who you need to go see that it's covered under your insurance. Under the UC SHIP plan, just so you know, mental health is offered to you through our CAPS program. They generally will see a student for about 5 visits and then write a referral for you to go see someone externally. And that would be a $5 copay if you're going to UCSD, or $10 under Anthem. And then if you'd like to do telephonic visits, we offer Live Health Online. That's on our website. You can do that for mental health as well as medical. And we also offer Lyra Health as a tertiary company. Our CAPS providers or student health providers will write you a referral to Lyra, and you can go see a provider on outside of the campus as well. So we have many different offerings. If you have mental health needs and you're on Medi-cal, your provider network is very limited. So definitely take a look at that and make sure that Medi-cal is meeting your needs for when you are transitioning to a new area on a new campus with new providers. So check with your insurance plan and make sure it's meeting your needs for mental health as well as medical.
Thanks. Okay, so this is a duplicate question, but is UC SHIP covered by financial aid? And what if they have a summary of benefit and coverage booklet that's a lot more than what we need. Do they attach the full file or just the page?
I'd start with your insurance card. When you're filing a waiver, if you're getting financial aid to pay for ship, again, financial aid is going to pull that money back from your award if you're not paying for UC ship. So you won't get $753 in your pocket. It'll go back to financial aid. So I can't emphasize that strongly enough, because we get lots of calls from students saying, you took my money. We didn't take your money. You didn't use it how they expressed how you should use it. So if you are filing a health fee waiver, you will not get that award as financial aid. And file the waiver on the Triton link using your insurance card. If you can go to the website of that insurance company and print out the 4 to 5 page summary of benefits, then I would include that. But otherwise, I would just take a few pictures of the front pages and then send that as part of your attachment. If they need more, they'll notify you via email.
Let's see. So if a student is on their parents' PPO plan, let's say through Aetna, do they need to still find a PCP in San Diego before completing the waiver?
No. So if you have an EPO, a PPO, or a point of service plan, you do not need to transfer your care to San Diego. I strongly encourage you to take some time and contact your member services and make sure that you know of a provider that you can come see here in this community if you get sick or you need to see a doctor for preventative services. The only people that need to change to comply with the waiver would be those that are in an HMO and you don't have a San Diego County doctor or Medi-cal.
Do we still need to submit a waiver for RAFT? I put RAFT is only offered for students with an approved waiver.
Yeah, you have to have an approved waiver to get the RAFT. And it's the last question on the questionnaire that you'll fill out to apply for the waiver. It'll say, would you like to grab a RAFT? And then it goes in depth of what the coverage is.
Gotcha.
And no, you don't need to waive it. You can just click on the no button.
If a student is enrolled in a specific MBA program and they'll have to do an internship, in that case, will they be covered by UC SHIP insurance, or will they need to have insurance through their employer?
You have to have one or the other to comply with the university guidelines. So I would say check with your department and find out what they're offering to you. They may supplement your pay and pay a little bit more so you can pay for the ship, but check with your department. They'll be the one that can answer that.
Thanks, Jill. That sums up all of the questions. Can you believe there were 71 questions asked?
That's awesome. Means you were paying attention and you want this information. And I know it's costly, and the rules of life are don't mess with people's money or their food. That will always get people upset. So we want to make sure that you have this information so you can make the right decisions for your healthcare as well as financially. We are here year round, as May indicated, and we're here telephonically, video visit, or email. So if you have a specific situation, I strongly encourage you to email us at SHIP3, and we can connect you with the resources that you need to continue your care without any interruption. I thank you for being part of this webinar. And as we indicated, the recording will be on our website a little bit later. I thank May for giving you the information and the slide deck. If you do have anything else, please, again, call us or email us or attend one of our Zooms. And I wish you the very best on your academic journey here. This is probably the best campus that you'll ever visit. It's beautiful here. You're right on the beach, for goodness sake. So what's bad about that? But just be careful while you're out there. And if you do see us on campus, please say hello. We love seeing students and we wish you the best. So thank you from me and thank you from May, and I hope you all have a good day, and let us know if you need anything further.